Dotiv, Integrative and Preventive Healthcare. The content discussed in this episode is for informative purposes only
and should not be replaced by individualized professional consultations or professional medical advice.
Hey guys, I'm Tasha.
Hey listeners, this is Goonie, and we're here to discuss lifestyle medicine.
Hi everyone, welcome to Dotiv The Podcast. In this week, we want to speak about something that is quite prevalent amongst women, which is PCOS. And for this topic, we have Dr. Jhajj, who is a qualified medical doctor and nutritional therapist who has a special interest in women's health. Thank you so much for being here with us, Jasmeen. We're glad to have you.
Thank you. Great to be here.
So welcome, Jasmeen. And today's problem statement, if we were to put it that way, is really, can I get pregnant if I have PCOS? As women who are in their 30s, we hear a lot of our, peers that are somewhat suffering with PCOS. And before we indulge in understanding what it is, I think it would be great to start defining what PCOS is. So the textbook definition says PCOS stands for polycystic ovary syndrome and is a common condition that affects a woman's ovaries and how it works. Polycystic ovaries contain a large number of harmless follicles. These follicles are underdeveloped sacs in which eggs develop. In PCOS, these sacs are often unable to release an egg, which means ovulation does not take place. Looks like there's no baby happening there. What causes PCOS?
So PCOS is essentially run by a hormone imbalance. When our hormones are working as they're supposed to normally through the cycle, we have a center in the brain called the pituitary gland, and that fires off some hormones, which are little chemical messengers. Now, these two hormones called luteinizing hormone and follicle stimulating hormone travel down to the ovaries and stimulate the maturation of the follicles. And this happens in a normal monthly cycle. They stimulate the maturation of lots of little follicles. And then what normally happens is one follicle is able to progress to a greater state of maturation, and the others all disperse and the others all break down. And then when that follicle undergoes ovulation, it releases an egg and a surrounding sac. And then that surrounding sac shoots off some more hormones and the cycle is complete. Now, if a sperm comes along and the egg is fertilized, then that sac is maintained. And if sperm does not come along and fertilize the egg, then that sac breaks down and the whole cycle starts again. Now, what's happening in polycystic ovaries is there's an imbalance in these hormones. So in polycystic ovaries, there's an increased amount of luteinizing hormone being shot off from the pituitary gland. And this leads to changes in the ovaries. So the ovulation is not able to occur as it normally would, and the follicles are not able to mature as they normally would. So then you get this buildup of, as you mentioned in your definition, the harmless follicles in the ovaries.
But how do we break it down to everyday Joe or Joanne can assimilate this information?
So essentially, PCOS is a hormone imbalance. The normal hormones that run through our monthly cycle are disturbed. And as the normal hormones are disturbed, the process of us producing our egg for ovulation is disturbed. And this leads to the accumulation of the tiny follicles that you have mentioned in your definition. And these follicles are stuck and they aren't bursting as they normally would do in a normal cycle.
And so you were mentioning the LH hormone, which is luteinizing hormone.
Yeah.
And apparently, so men and women are producing this hormone. Is that correct?
Yeah. So women produce this hormone to a greater degree. Men produce it to a much smaller degree. The reason why it's troublesome for women in higher levels is because it causes the ovaries to produce androgens. So androgens are male hormone and is the thing that can sometimes cause the troublesome symptoms that women with PCOS have. So the excessive hair, the balding around the front of the head, the changes in your weight, changes in your period, the acne, they can all be influenced by the androgens that directly produce the increase in luteinizing hormone. And with men, it's released to create testosterone in the testicles.
And is this hormone impacting the sacs ability to be fertilized?
Normally, you have a luteinizing hormone surge at the point of ovulation, but the ovaries are really sensitive to the level of luteinizing hormone. So if it's too high or too low, they won't burst, and then the egg won't be released. So in this case, it's too high. The environment feels incorrect, and the egg won't be released from the sac.
Okay, makes sense. And so from there, I've heard about cysts as well. And so how are they linked?
So the cysts are the little sacs that haven't burst. So in a normal monthly cycle of the ovaries will get lots of little cysts. One will become dominant and the others will regress back. So you end up with one which then bursts and releases the egg. But the cysts that they're talking about on the scan are basically failed ovulations and cysts that haven't regressed.
So these cysts, they were not able to be fertilized. And so do they just stay in the ovaries and grow into something that could be dangerous and harmful for the women?
So they won't become dangerous for the women, but they can obviously affect the function of the ovaries and if a woman can get pregnant or not. If they have a physical presence in the ovary, they are going to affect the way that the ovary functions and ovulations. So they can regress, they can come and go with monthly cycles, and they will respond to hormones as well. So they will respond to if a woman is trying to manipulate their lifestyle and their environment and their diet to try and help with their hormone balance. And so they are reversible, but they're not harmful, but it does take a lot of work or surgery.
I might be confusing conditions here, but there's people who have endometriosis. When they have cysts in their womb and they erupt, they can be potentially fatal. Is it a risk?
Okay, so in endometriosis, you have the normal endometrial lining is ending up in the wrong place. So when you have cysts in endometriosis, it's talking more about cysts. So a cyst is any fluid-filled sac. It can be anywhere in the body. It can be in the skin, it can be in the womb, but in the ovaries, we're talking about the fluid-filled sacs that are the failed ovulations. Whereas in endometriosis, you're going to be talking about cysts that would normally occur in the lining of the womb. So then more sort of blood-filled cysts that are painful if they break down. And that's why they can be dangerous, because they can bleed a lot because they've got a blood supply.
As you were saying earlier, like PCOS, hereditary or genetic, but then there are also other factors that could trigger it. Could you elaborate more on what those factors could be?
PCOS is a hereditary condition, but that's only part of the picture. Environment has a massive impact on whether or not someone with a genetic predisposition will actually develop polycystic ovary syndrome. And it's sort of described as an interaction between your genetic and environmental factors. There are several factors at play. Firstly, it's been found that in early puberty, there's an increased risk level of LH, and the anterior pituitary is also producing a decreased amount of FSH. So that's going to be your genetic component, where there's a physical hormone imbalance. The other factors that are at play that can be affected by the environment are specifically insulin is really, really important in the onset and the progression of polycystic ovaries. Now, it is released in response to increased blood sugar. So any meal we eat will eventually break that down to a simple sugar. And that sugar will go from the gut into the bloodstream. And the insulin works to push the sugar into the cells so that the cells can use it to create energy. What happens if there is too much sugar in the blood and we've had too much of a sugary meal, or we're having too many sugar spikes, is that hormones are chemical messages that travel through the blood, and they can attach to sort of any area. So the insulin will go over to the ovaries and it will create an excess production of androgens. And these increased androgens lead to the characteristic symptoms that we see in polycystic ovaries. So we see the acne, the hair changes, the weight gain, and the reduced ovulations. and reduction in fertility as well. So insulin is one of the main things from a genetic point of view that we can control, and why most of the naturopathic approach that you will see will be related to diet and exercise and reducing those sugar spikes.
So is there insulin friendly lifestyle, and what would it look like?
Yeah, so there is definitely an insulin friendly lifestyle. It basically consists of making sure that the food that you eat takes a longer time to digest and a longer time to get down to a simple sugar. So instead of white rice, you'd be going for brown rice because it takes longer to digest. Brown bread, you would be going for your vegetables over your processed food. And we work with clients to look at what they're eating and identify what they are having that is causing their sugar spike that they may not have noticed or they may not have realized. So sometimes it's to do with the timing of the day that they're eating, and they're leaving themselves to get too hungry and then they're overeating, or it's because there's not enough protein in their diet, because obviously protein is broken down to amino acids, whereas carbohydrates, so your potatoes, your bread, your pastries, they're all broken down to sugars. So it's, and amino acids don't cause the same insulin spike.
So someone who is on a plant-based diet, for example, might have, because when you think about a plant-based diet, is a lot of food that would be processed slightly faster than someone who is a carnivore per se. How is that managed if you're a vegan or vegetarian?
So vegans and vegetarians generally have a lower rate of diabetes and a lower rate of insulin problems, because if they follow a healthy vegan diet rather than a junk food vegan diet, they're actually eating a lot more vegetables and natural carbohydrates rather than processed carbohydrates, and a lot more whole foods. So as long as you're following a healthy vegan or a healthy vegetarian diet, you have a less issue with your insulin, because those that follow a meat-based diet, the meats are broken down to fats, and the fats can also cause, they don't directly increase insulin, but the fats also cause greater strain and greater inflammation on the body. And then that can also lead to the process of inflammation, can also lead to more strain on your hormones, more insulin release, and the more strain on the ovaries as well.
Makes sense.
And kind of to echo your point about insulin being a key factor in PCOS, right? Because you say weight gain. And do you see that with PCOS, there are many women who actually have diabetes or like are pre-diabetic in that process?
Yeah, so those with PCOS do have a higher rate of either pre-diabetes or diabetes. For sure, they are related. Resistance that comes first, or is it the hormone imbalance that comes first? And that is a question that science is still trying to answer. They're still trying to research, but we do know that if you have PCOS, you have a higher rate of diabetes. If you have PCOS, you have a higher rate of diabetes in pregnancy and after pregnancy. So you do need to be, those women need to be more careful.
What are the common symptoms you see to indicate to you that, you know, a woman has PCOS?
So weight gain, feeling lethargic is a really big one that is kind of ignored, but women can feel really, really lethargic. They can just feel really run down and they can't put their finger on why. Weight gain is another thing. Sometimes they can be getting random sort of lower pains around the ovary area, essentially, but they're not identifying that. They're just saying they're getting these on and off sharp pains and they don't know why. And acne is another one. Women don't necessarily present with abnormal hair growth because they've just been dealing with it and don't just feel like it's normal for them. So they may not present with the hair issue of growth.
Especially like South Asian women.
Yeah. But they will present with hair loss. So hair loss, acne, weight gain, pain, not really feeling themselves, feeling run down, feeling low. They're the main ways that women present. Or those that have been trying to get pregnant, feel fine, but have been trying to get pregnant and haven't been able to get pregnant yet.
You mentioned pain, right? And like random sharp pains around the abdominal area, uterus area. When you were explaining the cysts that could exist in the womb or in the uterus, right? If they are harmless and they don't really have any impact, but they're there, is that what causing the pain, or is there some other thing that's working?
Yeah, no. So in a normal ovulation, you can get pain. It's like an ovulation pain in the middle of their cycle. But if the cysts are there and being disruptive, then that can lead to slightly more of a sensation of pain. So when I say they're harmless, I mean they're not going to lead to cancer, is basically what I mean. But their presence can cause pain and can disrupt fertility. So in that sense, they are harmful, but I basically mean they're not going to progress to anything that's going to affect your life cycle, essentially.
Gotcha.
Because it sounds like PCOS is quite prevalent in general, because according to the NHS, PCOS is thought to be very common, affecting about 1 in every 10 women in the UK, which is quite big. Which is scary in the same time because do not have any symptoms. So that's what we've touched upon, the women who have symptoms and they come to you and they have this, but then there's women who do not have this. What do you make out of this finding?
Yeah, so I think it is really interesting that so many women are affected and they don't know. I found another stat saying from the Journal of the Endocrine Society that actually 6 to 20% of women of reproductive age are affected. So it's definitely across the board that there is a high amount of women that are walking around that are affected. Now, because these symptoms are vast and vague or attributed to normal fluctuations, maybe they're just not feeling well, or, women tend to dumb things down. They say, oh, it's just, just a blip in my cycle and things will be okay. A lot of women do go around undiagnosed. And I think it's great that things like this are raising awareness. These podcasts, these talks that women's advocates are going out and saying that, especially in ethnic minorities who feel that this is a bit more of a taboo, especially if they're having problems, for example, getting pregnant or problems with their appearance, just to do things like this to bring it out into the public eye. PCOS, endometriosis, fertility problems, they're not really spoken about and women really do suffer. So I think all we can do is really keep trying to highlight it so that women do get the help that they need and they get a choice of the help that they need. Do they want natural help? Do they want medical help? So they really understand the options for them. So you guys are doing a great job bringing the topic up.
Well, we try.
It's okay, don't worry. So basically women are choosing to get pregnant later when it is more convenient and more comfortable for them to bring a child into life and support that child. But because they're choosing to get pregnant later, more women are having assisted conception, more women are using fertility treatments because their biological clock isn't quite the same and their cycles aren't quite the same as they may have been when they were a bit younger.
Can PCOS be cured, or can we reverse it in any way?
Okay. Yeah, so it can't be cured, but we can control it. So there are medical and natural models to control PCOS. And when I say control it, I mean that we can get it to a state where you can get normal periods and you can get pregnant. So in PCOS, it's really common to have irregular periods. You don't know when they're coming. You might not have them for several months. Some women don't have them for a whole year. Now, in the medical model, we say that you want to have a period 3 times a year just to make sure that the lining of the womb is being shed and it's not causing any problems. So in a medical model, when you're trying to treat PCOS and you're not trying to get pregnant, you'd use hormonal contraception and you'd take that. And then when you stop that, you'll have a withdrawal bleed. So hormonal contraception works to regulate the cycles. And the progesterone in the synthetic progesterone in the tablets suppresses or inhibits the LH, luteinizing hormone, and the FSH, the follicle stimulating hormone from the pituitary. And that will also help with acne, abnormal hair growth and hair loss. And it also helps to stimulate a bleed when you have your week free of taking the pill. So normally the pill is taken for 3 weeks, you have a week off, and in that week off you'll have a withdrawal bleed. So those factors all are essential in PCOS if you choose to go down the medical route.
So effectively, as you're explaining to me, I feel that if you're on the pill, it's something that is orchestrated, right? Like the way your hormones are going to be behaving, and so you're actually in control of production, of release, and so it's really being orchestrated by this medication.
Yeah, so the progesterone is essentially the off switch for the LH and the FSH in a natural cycle. So by giving synthetic progesterone, you're switching off the LH and the FSH, and you're suppressing the hormone cycle. So by suppressing the hormone cycle, you're essentially suppressing the imbalance that is there. So that's why it's the first line treatment for PCOS.
Are there any findings out there that shows that there are potentially byproducts of being in this controlled environment of like hormones, potential harm for women?
So the combined oral contraceptive pill is a long known safe method. It's not harmful if it's prescribed safely. So some women aren't allowed to have estrogen if they have, for example, breast cancer, or they get really troublesome migraines, or they've had blood clots, or they have liver problems. So that's why they are, it is assessed by a doctor or a nurse before it's prescribed.
Right.
And then there is a follow-up on your blood pressure and your weight to make sure that it's okay. So if it's safe to prescribe and the monitoring has been okay, essentially it is, safe for you to continue. Now, it isn't without side effects. Any drug has side effects. We know that if you take hormonal contraception, you absorb vitamins less well from your food. So women who take oral contraception need to take that into mind and make sure that they take adequate nutritional supplements if they are on it. And those that don't can feel tired and can get brain fog and just not feel themselves. So I have seen many women who go on the pill, they have mood problems, they feel tired, they may gain weight. Now, these are all more sort of side effects, unwanted effects. They're not harmful effects as the medical model would place them. So if it's safe for you to have it prescribed, then it is safe for you to continue, but you may get side effects that you don't necessarily feel are comfortable or enjoy. And I have seen many women, particularly younger women that are 17, 18, still finding themselves, been diagnosed with PCOS, and then go on the pill and really, really just feel very low on it and have to stop. But it's not, that's all anecdotal. It's not, when we look into it with research, we're not finding that there is a link that can definitely say, yes, this is the pill, but we do definitely know that it reduces vitamin absorption, and it can affect mood sometimes. Yeah,
makes sense.
So we've been going through the medical perspective of how to address PCOS. From a naturopathic standpoint, what can we do to address PCOS?
So from a naturopathic point of view, we attack PCOS from multiple different levels. So we look at diet, we look at lifestyle, and we look at natural supplements. So from a diet point of view, as we've touched on already, it's really about making sure that you eat the rainbow, eat whole foods. Oily fish is really important because the essential fatty acids are really good for hormone production and sugar balance, essentially. And then we ask you to eat foods with a high glycemic index. So high glycemic index basically means how long it takes for the carbohydrates to break down into simple sugars. So the longer it takes for a carbohydrate to break down, the better. So your fibrous fruits and your natural vegetables and your brown rice and your brown bread and your grains are all really good. So we assess their diet and we give specific diet tips. Exercise is also really, really important. So exercise is important to increase the cell sensitivity to insulin. So it means that less insulin is needed to do the same job because the cells are more receptive to the insulin. And so incorporating exercise into your daily and weekly life is really important. We also look at the medical treatment that patients are having, and we don't alter that. So if they're on the contraceptive pill and they want to remain on it, we can work around it and we can support that. Some women are taking metformin, which is a diabetic agent, and that will help to reduce sugar and sensitize insulin. And we, again, just work around that.
So what about general supplements that we can take?
There are lots of supplements that are out there. The ones that I've decided to highlight that I find are evidence-based, have got a lot of research behind them, and are supported in the naturopathic world. So chromium's really important. Okay, so chromium reduces insulin resistance, and it also helps with diabetes and cardiovascular disease. So it's a supplement that you can buy. Fish oils, so you can get oil capsules or the actual oil. And if you don't want to use fish oil, you can use seed oil as well. So the omega-3 and the omega-6. They're really important in your sugar balance and, again, in your insulin resistance. And then there are vitamins. So specifically B3 is a B vitamin, which is a water-soluble vitamin that has been found to reduce your sugar levels and aid your control of your sugar. The reason why I say it's water-soluble, it's because it makes it relatively safe to take, because your body can get rid of it and you can pass it out in urine. So another trace element, which is good, is manganese, and that's also been found to be good in sugar balance. So those are the safest ones that I think are quite good to talk about today. Obviously, before you take any supplements, you should have a look at what medication you're taking, either speak to the supplement company or speak to your doctor or your naturopath to make sure that they're safe for you.
Yes, I've been definitely taking notes on this one. But say you want to get pregnant, which is what we're trying to answer today, is what is the naturopathic approach to it? Because the pill, when you need to re-regulate, it looks like it is a magic pill, but you feel like, you're in control, you see results very quickly. What about women who, really want to get pregnant and will go the naturopathic route? And also, is there a medical way to deal with PCOS if you're trying to get pregnant?
So if you're trying to get pregnant with PCOS, there is a medical route. There are things like IVF and artificial insemination, and they will be done on a case-by-case basis. Obviously, women who are being seen through the NHS, so they'll be asked to lose a certain amount of weight if they need to reach a certain BMI. And then they will be offered something called clomiphene. So clomiphene is a tablet that you take for a certain number of days in your cycle. And what it does is it works to support the dominant follicle. So as we alluded to earlier, in a normal cycle, there's one follicle that will win, that will go forward, and the rest will all disperse. But in PCOS, the differentiation between the winning follicle and the rest that's supposed to regress is reduced, and you end up with a collection of follicles. So in the use of clomiphene, it is encouraging that dominant follicle to progress, and then it is encouraging a successful ovulation. With regards to the natural process of getting pregnant with PCOS, as well as the supplements that look into sugar balance, there are a second group of supplements that help to regulate testosterone. So these are more sort of herbs and omegas. So we've got a herb called saw palmetto, which can be incorporated into supplements. And what it does, it actually reduces the conversion of testosterone to a more active form. So we have testosterone in our body, and normally it's converted to a more active form. And that more active form, that more potent form, is the thing that really gets into the cells and causes acne and the hair growth and disrupts the cycle. So by inhibiting that chemical, which reduces the conversion, which causes the conversion, you're reducing the conversion. So there is something called saw palmetto, is a herb that does that, and that can be incorporated into the supplements.
For the saw palmetto, that herb, is it something that we can find easily in those pharmacies?
Yeah, so you can find it in the pharmacy. I would look at where you're sourcing any supplement that you choose to buy. I would always run it past your doctor, seek naturopathic advice. Your naturopath will tell you where they think the best sources are. It is widely available. You can get it online. You can get it in the chemist.
Okay, that's good to know. So we were saying, so that's palmetto as a herb. What else can help to reduce the production of testosterone?
Yeah. So there is omega-6, the essential fatty acid gamma-linolenic acid, similar to saw palmetto, which reduces the conversion of testosterone to its more active form. And then licorice. So licorice root in teas, in supplements, can help to reduce the harmful androgens and hirsutism. So in the naturopathic model, we'll take these things, we'll look at a client's lifestyle, and we will essentially work with the supplements that we have and the factors that we can affect in their lifestyle and the diet changes and the activity changes that we can make. And we'll do that to essentially treat the root cause, which we look at as the hormone imbalance and the insulin imbalance. And by working with a client to control their insulin levels with the environmental factors and the lifestyle factors that we can put in, we hope that by reducing their insulin levels, reducing their sugar spikes, and aiding their hormone balance with the support, we are able to reinitiate a natural cycle.
Gotcha. So after going through all this, what are top 3 tips that women can take away to start their journey in helping themselves prepare to get pregnant whilst having PCOS?
That's a really good question. I think that the main thing that you need to do when you're trying to get pregnant with PCOS is, first of all, recognize that PCOS is potentially an issue for you, and seek help to get the diagnosis that you need. Okay. And once you've got that diagnosis, you are able to make a clear decision on the path that you want to take. So do you want to take the medical model route and use the medications that can help you ovulate and control your sugar balance, or do you want to take a more natural approach and try and treat essentially the insulin balance and the hormone imbalance that is happening from a root cause using the natural methods? So working with a naturopath, you'll take a very different route to working with a doctor. And I think the most important thing with anyone with PCOS, that whether you are trying to get pregnant or you're not trying to get pregnant, is to really look at what you can change and what's in your control. So obviously the genetics are not in anyone's control. We can't change those, and it's nobody's fault if anyone's got PCOS, but we can look at what is in our control and make small steps while you're making a decision on your bigger one.
Well, that's a great way to end.
Yeah.
But maybe before we end, I think women needs to hear a slight disclaimer as well with regards to how quickly they can see results. Have you noticed like a trend of the cycle of recovery or of seeing changes and impact on their ovaries?
Yeah. So if you go down the natural route is always slower than the medical route. Your body needs time to readjust, to re-regulate. Hormones need to be produced or not produced. So you're not going to see a quick, rapid, couple of week change with the natural method. The natural method wins in the sense that the changes are more lifelong.
Right.
They have multiple effects. You're going to control your blood sugar, your cardiovascular health.
Mm-hmm.
You're going to prevent the chance of you having cancers and strokes in the future, as well as aiding your fertility in the short term. Mm-hmm. Within a few months of working with someone, you can see their period starting to be a little bit more regular. And if your periods are more regular, that's a sign that your ovulations are more regular.
Yep.
And in those that needed and those that are motivated, because with the natural method, the onus is very much on the client. We can tell you what to do, but we can't make you do it.
Exactly.
So if a plan is followed, we do see cycles coming back within a few months. And then after that, then we can see fertility improving and pregnancy happening. Obviously, with clomiphene, you use it 1 month, you may get pregnant that month. It is like that. So it is shorter, but it is only affecting and addressing the fertility.
The natural aspect, I think, wins because you're basically teaching yourself to be sustainable on a long term. It is longer to see results, but I think that it is the most sustainable. And actually, as you said, the medical side do require you to reduce your BMI. So it does come with like lifestyle adjustments, etc., for you to reach that target. So I think leaving our audience with that message that, it's never going to be an easy adjustment. It's going to take some time, but it's worth the effort.
Yeah. And before we actually go into the rapid fire questions, in your experience with all your patients, do you see a trend in PCOS being more prevalent in a particular group of people?
So PCOS is common in ethnic minorities, it's common in Afro-Caribbeans, it's common in Asians. And I think it's mostly to do with the fact that, unfortunately, we have a higher risk of insulin resistance in our genetics. So from what I've seen and what I've read, that it is related to the fact that our insulin levels are more likely to be resistant. It is in all ethnic minorities. It is in all women in general, though. But there is a slightly higher prevalence in Afro-Caribbean and Asian ladies.
Yeah, gotcha.
Okay, that's good to know. So to conclude, let's go on to a more personal side of you, which is our rapid fire questions. And so the first question is, what is the first sign that you notice when you are out of balance?
So I tend to have problems sleeping when I'm out of balance. So if I'm a bit stressed, I find that my mind is racing and it takes me a bit longer to get to sleep. And then the next day, because I haven't slept very much, I'm craving sugar. So that's one of the main signs for me.
Right. Okay. That's a good one. And I guess to counter that is, what is your method of coping when you find yourself out of balance?
Exercise. So I love to go to the gym. And when I can get there, I know that I sleep better. I feel a lot more energetic. When I'm in the gym and I've got a problem, all the answers come on the running machine. And then when I get home, I've forgotten them.
I can definitely relate to that. There's like a moment where you're bub moment. You're like, oh, done. Yeah.
But I've forgotten them by the time I get home.
That's why I sometimes take notes, because you're like, okay, this is a magical moment that's happening. Let me just quickly take note of this. I totally relate. And our last question is, what is one book that impacted your approach to wellness and well-being?
So there is a book by Pizzorno and Murray, which is the Clinical Handbook of Natural Medicine. And that is a real eye-opener for me. It covers lots of different topics. And it's kind of like your equivalent to a medical textbook. So I'm obviously very used to working from medical textbooks. And it has a very medical format. But that book has allowed me to understand natural medicine from a scientific perspective. So it's been really helpful for me in my practice.
Great. Thank you for sharing that, Jasmeen. Well, it's been really, really a pleasure to have you and for you to break down the medical side and also the naturopathic side of PCOS. And I really hope that women listen to this episode and will feel a sense of relief knowing that they're not alone in the process and there are answers to their problems.
Thank you. Nice to be on here.
Thank you, Jasmeen. All right.
If you enjoyed this episode, go ahead and select that follow or subscribe button. For now, stay safe and we'll see you next week.